What are some requirements for medical malpractice claims? Attorney Brian Hansen explains that. There are a few basic requirements for a medical malpractice claim. First, there must be a doctor-patient relationship. In other words, if you were to overhear a doctor talking outside of his practice, there would be no claim against him if he were to offer advice to a random person. You have to prove the doctor was negligent, and their negligence caused an injury. In legal terms, a doctor is negligent when they breach a standard of care. The standard of care is a subjective term, but you are asking whether the doctor gave you, as the patient, care that caused you harm relative to the standards within your community. The most common ways in which medical providers breach the standard of care is through a failure to diagnose, a failure to treat or properly treat, and a failure to warn a patient of known risks. Just to go through those quickly, under a failure to diagnose claim, we, as the attorneys, are looking to see if the outcome of the patient could have been different had a competent doctor discovered the patient's illness or made a proper diagnosis. Under a failure to treat or properly treat claim, we are looking to see if the medical provider recommends appropriate treatment and if the treatment they recommended as appropriate was actually administered competently. Finally, under a failure to warn claim, we are looking to see if doctors advise patients of their known risks of a procedure or treatment. This is known as the duty of an informed consent. If a patient was not properly informed of possible risks and would not have elected to go through with the procedure knowing the risks, then the doctor may be liable for medical malpractice if the patient is injured by that procedure. Call the personal injury attorneys at Feller & Wendt in Utah for a no-fee consultation. They will explain your rights and give you comfort of knowing they will be there every step of the way.